Hello and welcome. My name is Kirsten, and we're going to talk a little bit about perineal tears and what they are and how to manage them afterwards and what has happened. So, when we have a baby, we have perineal tears. Now, this is different than tearing of the pelvic floor musculature in a way. So, when we have a grade 1 tear, grade 2 tear, grade 3 tear, and grade 4 tear, they are managed a little bit differently. So let's explain this. So when we have a baby, so this is the muscle of the pelvic floor, and we have the skin that covers over top. And when we have a baby, the skin that's between the vagina and the anus is the perineum. And you can have tears around the vagina at the perineum. You'd also have tears that go up towards the clitoris and into the labia. But let's go from, let's say, a grade 1 tear. And it's like you're tearing, I'm not sure if you can see with my skin. So this part's just the skin. It's not actually in the muscle yet. So it's like you're tearing just the skin of the perineum. And there might just be a teeny little tear there. They don't even require sometimes stitches, or a little bit more of a tear. They might give you a few stitches. It doesn't tend to create any alteration to the tissue, or it might sting a little bit when we have a pee, but not too bad. Then we have a grade 2 tear, and that's where it's gone through just the skin tissue and into the muscle of the perineum, and that requires more stitching. And therefore you can feel tugging or pulling at that area. The more stitches have more repair we have to be very careful with infection. And we can have sometimes more stinging with peeing, or even sitting down. We can feel some discomfort when we sit down. And so you want to rest a little bit more. You want to make sure that you lie down, rest the area. Don't do too much that you're going to pop a stitch, because then depending on what has happened, you don't want a lot of that tissue to come apart. And then we have the grade 3 tear. So the grade 3 tear is going through the perineal area, through the skin tissue, through the muscle, and towards this muscle here, which is at the anus. So it'll start going into the sphincter muscle of the anus, and that's where they're really going to go in and do a lot more stitching and repair. And they're going to really make sure that you don't have any constipation or have to push with your bowel movements. Even with grade 2 tears, sometimes they'll give you stool softeners, but especially with grade 3 and 4. So with that grade 3 tear, you want to make sure that your poops are really smooth, you're drinking lots and lots of water, especially if you're breastfeeding also, and that you're staying hydrated. So you're having sort of that 3 liters-ish or so, and you're getting good fiber, and you might be taking a stool softener too, which can help to move the poop through your rectum and out the anus without having to push, because it can hurt to push. And making sure that if it is very sore, you can lie down. You can put a pillow underneath your hips and have your hips elevated. You can use cool compresses on the area, so keep it nice, and you don't want to put an ice pack straight onto your skin. That's really uncomfortable, but you can have a wet cloth and then put the ice pack there. So that can be done sort of 10-15 minutes, and just be cautious that you don't leave it there too long, because you can damage the skin tissue. So you can do some of these things to help with the area, but it will be sore. And then of course a grade 4, well, what does that mean? It means from the vagina, you go through the skin, through the perineal tissue, into the external anal sphincter, and then right through into the anus. And those ones require a lot more surgical care, and they're very uncommon. They don't happen very often whatsoever. These tears tend to happen more in our first deliveries than other deliveries, because our tissue it's strong and it's intact, and it's a little bit more prone to be damaged with that first baby coming out. And then after the first one, the second, third, whatever, depending on how the baby's coming out, of course, but they have often a little less damage at that time. So when the pelvic floor therapist or your women's health physiotherapist asks you, do you know what type of tear you have? It gives us an idea of what you're healing like. So a first degree tissue tear is taking around anywhere from 2-3 weeks, and then you're feeling pretty good. Something like going into the muscle, we're looking at maybe sort of 4 weeks or so, until it feels like you can't really feel it too much. And the tissues will be often dissolvable. A grade 3 or 4 tear that requires more stitching and to make sure that everything is back together again, we're looking at longer term, like more 6 weeks or so before you're truly healed. And there can be a lot more scar tissue around there that we might want to go in and release some of that scar tissue and get it so that your muscle starts to work a little bit better. And when we have this type of damage to the pelvic floor musculature, it can make us retract and tighten up our pelvic floor because it hurts. And so we do some muscle guarding. And of course, we can go in as pelvic floor therapists and we can gently, after you've healed, of course, gently go in and release some of that tighter tissue. And we can even work on scar tissue in there to kind of try and make it so that it extends out a little bit more and is not so thick, as sometimes the scar tissue can be a little bit irritating during intercourse, or if they've stitched you up, or if they've stitched you up and you feel one area is quite tight from where the stitches are, we can go in there and assess it and then start working on that tissue as well. Okay, I hope that explains what the perineal tears are and gives you a little bit of idea of how to care for yourself afterwards.